just going to get my second RN to come with me to the drug room. Morphine.
Okay, so we've got Miriam Adib to be given morphine 50 milligrams in 50 mils via PCA. Good morning, Miriam. My name is Jia. I'm a student nurse from Western Sydney University. I'll be taking care of you today. Miriam, I've just read through your notes and I understand that you've got some fractured ribs. But before I continue, can I get a full name and date of birth from you?
Yes, it's Miriam Adib. Date of birth 7th of the 1st, 1969.
Brilliant. And your MRN is 174963. Excellent. Are you allergic to anything, Miriam?
Not that I know of.
Okay. Miriam, so I'll just do a pain check on you. How much pain are you in at the moment? Between 0 being nothing, 10 being excruciating pain.
It's about an 8.
Okay, and where is the pain?
In my chest.
Okay, and how long have you had this pain?
Probably the last 30 minutes.
Okay, so we'll do a full vital check on you. But before I go, can I just check your cannula site? If I press around the edge here, does it hurt, Miriam?
No.
Okay, so there's no redness, there's no swelling, there's no signs of phlebitis. So we're ready to go ahead with this. I won't be long, Miriam. You've got your buzzer here. I'll just go off and collect my equipment. I'll be right back. Sanjeet, can you validate my medication order with me, please? Okay, so we have patient Miriam Adib, date of birth 7/1/69, MRN is 174963. No known allergies. She's come in post-rib fractures. She's been prescribed morphine 50 milligrams in 50 mils, signed off by the doctor, dated for today, to be given via PCA IV morphine. Concentration 1 milligram per mil. Number of syringes is 3. PCA dose is 1 milligram. Lockout interval is 5 minutes. Basal infusion is 0 milligrams per hour. Max hourly limit is 12 milligrams. Has been signed off by the doctor. She's been prescribed some antiemetics as well, metoclopramide, to be given 10 milligrams via IV. Intervals of TDS, and has been signed off and dated. Naxolon has also been prescribed. So dose is 0.2 milligrams via IV. Interval of 2 to 3 minutes, has been signed off by the doctor and dated, and the medication hasn't been given yet. Do you agree?
Yes.
Yes. Okay, so we'll just go ahead and look this up in the NIMS as well. Okay. So we've got morphine sulfate to be given for adverse pains, and currently Miriam states her pain to be at 8 out of 10, so she fits the criteria. Contraindications for this is acute to severe asthma, respiratory insufficiency, or depression. Precautions are large doses, rapid administration. Then we're also adverse effects are respiratory depression, apnea, cardiac arrest, impaired alertness, and max dose to be given is 15 milligrams per hour per 4 to 6 hours, but she's well within that at 12 milligrams, and it will be given via IV. Oh, and we'll be monitoring her 15 minutes after administration. Yep.
Yes.
Okay. So we'll just wash my hands and we'll gather the equipment. Just gathered all my equipment and I'll just do my drug calculations. Okay, so my formulary stock required over stock strength times volume over 1 equals. So we've got stock required is 50 milligrams. And stock strength is 10 milligrams times 2 mils equals 10 mils. So I'm going to require 5 vials of morphine. And I'm going to require 40 mils of dilutant. Do you agree with that, Sanjeet?
Yep.
Yep? Yep. Okay, thank you. Okay, so we're just at the drug cabinet. We're going to take out some morphine. Notice that the booklet says that there's 20 vials been received from pharmacy. So I'll just count that through. I've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, so there's 20 in there ready to go. 23rd of the 5th of 17. Time at the moment is 13:10. Patient's name is Miriam Adib. To be given 50 milligrams. Balance, once I take out my 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 6, 7, 8, 9, 10. 11, 12, 13, 14, 15. So I've noted that at 15. Prescriber is L. Hunt. I am Jia Dupre. Sanjeet, do you mind just signing there for me, please? Yeah. So just to confirm, we've got morphine 10 milligrams in 2 mils. So according to my calculations, I need 5 vials, and I've got 1, 2, 3, 4, 5 of morphine sulfate, 10 milligrams in 2 mils. So I'm just going to put away the remainder into the cupboard. And I'll just put the book away. Sanjeet, do you mind doing my first drug check with me? Okay, so we have female patient Miriam Adib, date of birth 7/1/69. MRN is 174963. She has no known allergies. She's come in post rib fractures to be given PCA IV morphine, concentration of 1 milligram per mil. Number of syringes is 3. PCA dose is 1 milligram. Lockout interval is 5 minutes. Basal infusion is 0 milligrams per hour. Max hourly limit is 12 milligrams, has been signed off by the doctor and has not been given yet. So we have the 5 vials of morphine sulfate. 1, 2, 3, 4, 5. So we've got morphine sulfate 10 milligrams in 2 mils, expiry 10/20. Morphine sulfate 10 milligrams in 2 mils, expiry 10/20. Morphine sulfate 10 milligrams in 2 mils, expiry 10/20. Morphine sulfate 10 milligrams in 2 mils, expiry 10/20. Morphine sulfate 10 milligrams in 2 mils, expiry 10/20.
Yes.
So we also have our diluent here, sodium chloride. As per calculations, we required 4 vials, so we have them here. So we've got sodium chloride, 90 milligrams in 10 mils. Expiry is September 2018. We have sodium chloride, 90 milligrams in 10 mils, expiry September 18. Sodium chloride, 90 milligrams in 10 mils, expiry September 18. Sodium chloride, 90 milligrams in 10 mils, expiry September 18. Are you happy with that?
Yes.
Okay. So I'll be drawing up my 40 mils of sodium chloride to start off with. So Sanjeet, just confirming that that's 40 mils of sodium chloride. Do you agree?
Yes, I agree.
Okay, so I'll just continue with drawing up the morphine.
So this is the buzzer. So you just press that when you're in pain. What I was going to say as well with the PCA, the lockout interval is every 5 minutes, so you can only get pain relief every 5 minutes. But just so you don't overdose or really give you enough. I'll be back in 15 minutes. I'll give you the call button as well. So press this if you need me. And I'll see you soon. Get my second eye to work this fine.
Okay, so just confirming that that's 50 mils of morphine and sodium chloride. Do you agree, Sanjeet?
Yes, I
Yep.
agree.
Sanjeet, do you mind doing my second drug check with me? Okay, so we've got female patient Miriam Adib. Date of birth is 7/1/69. MRN is 174963. No known allergies. She's come in post-rib fractures. To be given morphine 50 milligrams in 50 mils, signed off by the doctor for today's date. To be given PCA IV morphine, concentration of 1 milligram per mil. Number of syringes is 3. PCA dose is 1 milligram. Lockout interval is 5 minutes. Basal infusion is 0 milligrams. Max hourly limit is 12 milligrams. Signed off by the doctor, hasn't been given yet. So we have morphine sulfate here, 5 vials. Morphine sulfate 10 milligrams in 2 mils. Expiry 10/20. Morphine sulfate 10 milligrams in 2 mils. Expiry 10/20. Morphine sulfate 10 milligrams in 2 mils. Expiry 10/20. Morphine sulfate 10 milligrams in 2 mils. Expiry 10/20. Morphine sulfate 10 milligrams in 2 mils. Expiry 10/20. We also have sodium chloride here. So we have sodium chloride 90 milligrams in 10 mils. Expiry September 18. Sodium chloride 90 milligrams in 10 mils. Expiry September 18. Sodium chloride 90 milligrams in 10 mils. Expiry September 18. Sodium chloride 90 milligrams in 10 mils. Expiry September 18. We have that all done there. 50 mils.
Yeah.
Are you happy with that?
Yes.
Okay. So I'm just going to fill in the additive label. Our patient is Miriam Adib. ID is 174963. Date of birth is 7/1/69. Medication is morphine. Units are 50 milligrams divided by 50 mils equals concentration of 1.0 milligrams per mil. Diluent is sodium chloride, 0.9%. Okay. Today's date is 23rd of the 5th, 17. Time is 13:35. Prepared by me. And Sanjeet, do you mind signing? Thank you. Okay, so I'll just put this away and fix the additive label onto the syringe. I'm going to fix it so that we can see the numbering. And just slide it across. So you're able to see the numbering and also the text on the syringe. And I'll just go wash my hands. So I'll find my line.
it would. I know it would be exhausting.
Just undo my needle and dispose of that in the sharps bin.
I'll be like, it is.
I'm 53.
Alright, so
I'm going to go ahead and prime my line.
for about a week.
Okay, so no bubbles. Okay, so I'm just going to go attach the syringe to the PCA pump. I'm going to place it so we're able to see the label.
So that would be now the balance, and this way
Okay, so that's in place. I'll just lock the pump, sorry, the syringe. I'll have that. So, I've modified protocol. So, drug name, morphine. Concentration is 1 milligram per ml. PCA dose is 1 milligram. Interval lockout period is 5 minutes. Occlusion is level 8. That's fine. Continuous, yes. Max limit is to be reduced to 12. Confirm. Is that okay? So I'm just going to confirm the syringe type. Confirming protocol, yes. So it's the Termero syringe, and we'll just press OK. Hi Miriam, I've got your medication ready. Just need to do my second patient check. Can I get your full name and date of birth, please?
Marion Adib, date of birth 7th of the 1st, 1969.
Brilliant. And are you allergic to anything, Miriam?
Not that I know of.
Okay, so Miriam's MRN is 174963. 174963. Okay, Miriam, we'll get this started for you as soon as possible. Sanjeet, do you mind doing my third drug check with me? Okay. So we have female patient Miriam Adib, date of birth 7/1/69. MRN is 174963.
Yes.
No known allergies recorded. Full post rib fractures.
Yep.
To be given morphine, 50 milligrams in 50 mils, signed off by the doctor for today's date. PCA IV morphine to be given, concentration 1 milligram per mil. Number of syringes is 3. PCA dose is 1 milligram. Lockout interval is 5 minutes. Basal infusion is 0 milligrams per hour. Max limit is 12 milligrams. Signed off by the doctor, hasn't been given yet. We have 5 vials of morphine sulfate, 10 milligrams in 2 mils, expiry 10/20. Morphine sulfate, 10 milligrams in 2 mils, expiry 10/20. Morphine sulfate, 10 milligrams in 2 mils, expiry 10/20. Morphine sulfate, 10 milligrams in 2 mils, expiry 10/20. Morphine sulfate, 10 milligrams in 2 mils, expiry 10/20. We have 4 vials of sodium chloride. Sodium chloride, 90 milligrams in 10 mils, expiry September 18. Sodium chloride, 90 milligrams in 10 mils, expiry September 18. Sodium chloride, 90 milligrams in 10 mils, expiry September 18. Sodium chloride, 90 milligrams in 10 mils, expiry September 18. Do you agree with that? And we've got that inserted into the PCA pump there.
Yes.
So I'm just going to go wash my hands and put my gloves on. Clean Miriam's. Hi Miriam, I've got your medication ready. Just going to clean your cannula site, okay? So I'm just going to clean it for 15 seconds. And just dispose of that. Grab the line. And that's attached. Okay. So I'm just going to tape Miriam's line up here. Okay, Miriam, I'm back. Miriam, I've got your medication all in the pump ready to go. I've pressed start. That's your buzzer there. What you do is you press that once and it'll give you a dose of morphine. You can press that once every 5 minutes. Anytime you're feeling pain, just press the buzzer. Now, Miriam, I'll come back in 15 minutes to check on you anyways, but if you need me before then, by all means, press the call button. It's right here next to you, and I'll be back as soon as possible. Okay?
Yes, thank you.
All right. So I'll see you soon. So I've just cleared everything out, and we can dispose of that. Wash my hands and fill in my medication chart. So today's date is 23rd of the 5th, 17. Time up was 13:35, and my initial is JD. Do you mind signing, please, Sanjeet?
There you go.
Thank you very much.